And it is a very great opportunity to meet such a great institute you are serving. And I'm lucky that I have been selected by you, and particularly Mr. Vishal, who is my very close friend, and Miss Jennifer. So I thank you all. And just starting from the, you have introduced a lot, but I am not, it is nothing what I am doing. It is my duty and it's my responsibility to carry out these activities, what I am doing right now. So talking on the healthcare, pharmacy and nursing aspect, yes, this is indeed a noble profession. I agree. I consider each and every profession who are working, who are contributing for the nation building, each and every profession is unique and it's significant. So I agree, healthcare is there. Healthcare is an important aspect, but each and every work item, whoever is doing, wherever it is doing, is being done, and it is important, it is significant. That's how the ecosystem goes. But yeah, talking to regarding this noble profession, I must say I feel lucky to have this profession. I'm grateful to my parents, my seniors, my teachers, and my fellow classmates. The thing is that when coming to this career profession, this, the stethoscope which I am carrying right now, that was gifted to me by my father when I was in class 6. I did my schooling from residential school in Deoghar, Ramakrishna Mission Vidyapit. So during that time, I had a dream to serve the people to my best possibilities. Now, considering this noble profession, what I experienced is that before my entry level into this medical field, I mean, before appearing in the entrance exam of MBBS, I had one thing very clear and very crystal clear, that I have to get that seat. I am from the general category. I have to get that seat. That was my determination. And for that, whatever I need to do, I have to do. So regarding that, I have carried out my studies well, and it was an indeed a great time. Now I can see that during, because of my that time, tough time, it was going through the books and taking guidance of the teachers, that is very, very important, and my fellow classmates. During my higher secondary time, we had a chunk of group around 40 from my schooling, class 2. We were all together that we have to go through that examination. It was a competitive examination, and I got through it. And I have seen during that examination time, I was told by my seniors, my teachers, that you will face some wrong questions during the time of examination. You have to select that. You have to have the practice so much that you have to identify the wrong questions, because it is not a selective test. It is not a passing out test. It is a competitive, and it is elimination test. You will be eliminated. So keeping on that thing in my mind, I have studied a lot. Yes, I do agree. I have studied a lot. So now, regarding the question hour session, I'm not very clear that on what aspect I will speak. But
No,
you
Dr.
can.
Bhaskar, there are questions coming in, of course. So we've got class 11 and class 12 students with us, and there are
Excellent.
students who are looking for getting into the profession of medical, healthcare, nursing, and pharmacy. So for
Fine.
healthcare, prepare for becoming a doctor? Tell me, a class 12 student, how does he need to prepare? What are the areas he need to focus on? Because you are a stalwart, you've achieved all that flawlessly. So what is your guidance to these youngsters who want to become a doctor like you, Dr. Bhaskar, who want to be Dr. Bhaskar too, possibly?
Yeah, one thing is very important, that competition is there. There is no doubt about that. Competition is there. But the primary aim has to be, there are two aims. One is primary, one is secondary. Primary aim is we have to get the seat. We have to pass the qualifying examination. And number two is that we have to be very much determined that after passing out, we will serve. That keeping that motivation in the background, not for earning money, not for extracting money from the suffering patients. I prayed, you will not believe, I prayed daily to Almighty that if I become a medical personnel, I will serve, not keeping in my mind that I will earn. See, earning will be in the background, but serving the people is the best satisfaction. That is the best satisfaction which one can achieve. So keeping these two things I have kept in my mind. I have to pass the examination. For that, I have to study. Yes, during my MBBS, during my higher secondary time, I had another hobby in my system, that is observational astronomy. I used to spend time and nights looking at the sky, because that made me concentrated and focused. We have to be in focused mind, that we have to pass the examination, because that is the target. So now it is a very common thing that there will be an uniform and single examination. So we have to prepare for that. Our preparation is the background of the higher secondary, what we are doing in physics, chemistry, biology. So we have to, I have made my ideal Dr. Stephen William Hawkins. I think most of you have heard his name. He is the greatest physicist who used to have the Einstein's chair. So I have gone through one of his book which stimulated me a lot. Not that brief history of time, because one autobiography written by Michael White and on Stephen William Hawkins. I have, during that higher secondary, in the just I have passed the 11th, that one of my cousin, he gave me this book. I have gone through it, and I have seen the way he has told. He has structurally emphasized on the routine activities. Daily I have to do 1 hour this study. Daily I have to do 1 hour this study. Like that I have segregated my study hours. So in the morning hours we will study this, and that was without fail. And by God's grace, I was not ill a single day during that time, because I have kept one promise, that once I become in the profession, I will serve my people. I will serve with a motivation that each and every people who will come to me will get the service. That was my background. I have prayed for that. I think I was lucky that I got the 6th position in the entrance exam, and there were, I still remember, I passed that exam in 1990, immediately after higher secondary. I have identified 6 wrong questions, and after passing out, after finishing, coming out from the competitive examination, I told my seniors, my professors, that I have identified those 6 questions which were wrong. Yes, that is how you have differentiated from others. Maybe those who were in the earlier the upper positions, they have also done like that. But the thing is that what I mean to say is that we have to be determined. Number one. Number two, yes, we have to study the things, not on the exam oriented, but on the understanding orientation, because you do not know what questions we are going to get in the qualifying examination. That is not a passing examination by any case. That is an elimination
So, Dr.
examination.
Bhaskar, the students who are currently in class 12 preparing for medical, what are the
Yes.
dates they should keep in mind? Because obviously the entrance examinations happen somewhere around April or May, if I'm not wrong.
Yeah.
So, of course, for this particular batch, the students that are in class 12, so what are the dates they should keep in mind? The examination, the entrances, and of course, there are students I see that some of them who are not able to get into the medical numbers or possibly the medical college, they often fly to Russia as well for medical science. So, what's your vision on that?
Mm, best is to opt for the Indian system,
Okay.
because you do not know how the international relations are going to take place in the coming future on various aspects.
Right.
In that context, yes, there are plenty of medical colleges right in now in the country, and the number of seats have also increased, and the system which have been in place right now in the medical field is much better than what we had. Yes, we have to target the medical field in the medical colleges first in India. If option is not there, then many people, but very frankly speaking, very truly speaking, the Indian system of medical education is very, very strong, very, very significant. I am not aware of Russian system. I should tell it truly. I am not aware of that. But I have not seen, I have not met a single person till now from my 2000, say 1996, I passed out my MBBS. I have not seen, I have not encountered any person with this Russian background. I am not
So
aware of
any
that.
student who wants to get into AIMS as a
Yeah,
student, All India Institute of
yeah,
Medical Sciences,
yeah.
what steps he should take?
First, though, he has to carry out his studies right now for the 12th standard, and all the question guides, all the multiple choice questions from the previous years. That is very, very important. And daily basis, I had spent morning 1 hour, evening 1 hour to carry out this the practice questions. The practice questions has to be taken care, the previous questions. That makes a because I have not opted for any other question, any other competitive exam. I had my all Assam entrance. I am from background is from Guwahati, so I was determined that I have to pass that. I was focused. That's why I have not tried any other locations. So in that way, one is to fix that. That is very, very important. And the practice questions of previous years, there are plenty of books are there. Whatever books are there, whatever questions guides are there, we have to practice that. And then daily basis, 1 hour evening, 1 hour morning. That is very important. What Stephen William Hawkins has stated in his book, that practice daily 1 hour and evening 1 hour. The 2 hours means 60 contact hours with the book. That is very, very important. That impacts a lot on the examination part, and we will be having a visual impression of the questions and answers once we are daily on that system.
So
So
these practice tests that you're talking about for the medical students, how long?
yeah,
I mean, should they pick up the last 4 years practice tests, or should they pick up the last 6 years
enough,
practice?
enough. 4 years is enough. You are right.
Last four
four
years, all
years is
right.
enough. That is enough. And at the same time, they have to go through the books. What books they are going to the for this class 12 examination, that has to be practiced. So I have made some permutation combination, because we have, the brain is very, very strong. Human brain is very, very strong, and hardly we use 5 or 6% of that. So remaining is total open. Yes, we do have to take care of the body activities like exercise, free mind, yoga, this type of free hand exercises we have to have. And daily I used to have a brisk walking for 30 minutes, morning 15 minutes, evening 15 minutes. That is important, because once you carry out your studies daily basis, what I am talking is not an easy thing, because daily 1 hour, 1 hour, like that, you have to segregate the timings, and you have to take care of your health also, that you should not feel ill. That is very, very important. And on that basis, things will come out definitely, but one determination is very, very important.
Okay, so when a student makes it to the medical college and he gets selected, he or she gets selected,
Yeah.
what are the different disciplines within the medical science? Of course, they are huge. So, what is the first gate that the student should look at? The second gate, where does the bifurcation start? Like, first is the MBBS, as we all know. After
Yes.
that, the specialization starts. So, if
Yeah.
briefly you could just tell a little bit of a skeleton of the medical courses that are available
Yeah.
today.
See, one thing is very, very important. Once when one candidate enters a medical system, uh, during that time, he has to keep 2 or 3 mentors in his mind, seniors, 1 or 2 seniors who he will select, he will have a trust, and he will be guided. See, teachers are already there, but seniors impacts a lot. A good senior in the same field will help a lot. I got the similar help from one of my very senior. He was only 3 years senior to me. Now he is right now the Netherlands Society of Radiological and Ultrasonology. He's the president of that society. He used to guide me. He used to tell me what way one should go for this. And he never stood second in the first MBBS, second MBBS, third MBBS. 3 professional examinations we have to pass in the MBBS level. So during that time, he used to tell that first, after finishing out the MBBS, we should not target for MD or MS or postgraduate. You have to
Okay.
have a practice of at least 2 to 3 years in the field, because I have seen many of my friends who are specialists, who are super specialists, but they do not have uh, the courage to handle a very serious patient. See, out of a community, hardly 1 or 2 medical persons will be there. So I can tell you, in a community, if 8 doctors are there, hardly 1 or 2 will rush to handle an emergency, because of the fact that he is a super specialist or she is a super specialist. So that thing comes. What I was guided in this way, that after finishing the course, we have to serve a very busy hospital for at least 2 to 3 years. Then the fear of the patients will be gone. So that what I am going to emphasize that after passing out, one should serve as a general medical officer, not a specialist, because you will come in contact with many types of patients, and at the same time you will be guided by seniors who are experts. So
One of
that
the things,
confidence.
one of the
Yeah.
things, Dr. Bhaskar, that comes is that if you break your studies in between and get on to a medical profession, you will never
Yeah.
be able to get back to studies. So, what do you have to say? Because if a student finishes his medical, starts general practice, then coming back to studies after 2 years of working, will it be difficult? Will it be challenging?
No. But that practice of updating for the next entrance exam, for the next entrance exam is the MD or MS, the postgraduate.
Yes. Yes.
Daily 1 or 2 hours we have to spend. Daily 1 or 2 hours medicine. That practice of studying has to be there.
Hmm.
That is very, very important. You cannot leave suddenly after 2 years. If you come on the study platform, it might be little difficult. I have never done like that. I have
Okay.
spent 3 years in a rural area in Arunachal Pradesh. There I served for 3 years, but daily I used to study. I was determined that in biochemistry I will do my MD, so in my post graduation will be done. And for that reason, after I passed out the MBBS, I have purchased my books for biochemistry,
So what
the
you
best
suggest
books.
is that if you finish your medical and somebody wants to be a heart surgeon, you
Yeah.
advise that you finish the course, become a general physician for 2 years, keep studying throughout these 2 years, and then go on for your, heart surgery or the upward mobility course.
I'm not getting. Can you just tell me
No,
again?
so what you're suggesting is that if a student wants to, let's say he wants to become a heart surgeon or a, heart specialist. So
Okay.
what you suggest is the student takes a break of a year or two, practices general physician course, practices under a doctor, keeps studying and then moves up for studies again.
Yes,
That's what
yes,
you're
yes, yes, yes.
all right. So medical, of course, profession is very interesting. A lot of students become doctors, but simultaneously, I think nursing and pharmacy is also something that's very, very enticing for students because not everybody can become a doctor. So what do you have to say about the route that students need to take from class 12 to become a nurse, or for that matter, if I talk about get into pharmacy?
Yes, these two paramedical courses, in particular in pharmacy, and also a new updated things are coming up on applied nutrition. That is also an important thing, and also in physiotherapy. See, in abroad, these things are very, very common, and due to very limited number of specialist doctors or consultants, these allied subjects, particularly the nursing, the pharmacy, those things are being very well taken care of. In our country, it is true that things are being taken care in that way also, and number of seats have also increased. The educational facilities are being improved, and lots of practical sessions are being conducted. And at the same time, this pharmacy has got a tremendous scope. The nursing has got a tremendous scope. Globally, it is very, very right now crisis is there. People are going immediately, after serving for some time in a hospital, they are moving out. The demand is already always there. Demand for a good nurse, demand for a good pharmacist is very, very important. And now India is developing in a very rapid way, particularly in the service sectors on this nursing. Because while in the hospital, we have seen that the nursing unit is the core unit which takes care of the patient at under direct observation. So a good nurse will always be a very important and significant player in the whole medical system. I consider the entire system of doctors, nurses, pharmacists, physiotherapists, and also the medical assistants, even the technical sectors, the technical field, these are all challenging. Scope is very strong, but limited. Good persons are in limited quantity. So that becomes a very tough thing.
Okay, getting into the questions, we are getting some questions there. Ankita Pukan is asking, would you prefer private medical colleges in India?
First, opt for government medical college.
Okay.
First option is there. I have done my MBBS in government medical college. And so the first option has to be, just 1 second, can I? Okay, fine. The first option should be in government medical college, because
Right.
cost factor is there, but at the same time, not in all private medical colleges, I must say, not in all private medical colleges, the as far as what I have observed and what I have heard, that the service by the professionalism is not that very strong in all the private medical colleges. There are private medical. I have done my MD, my post graduation from a private medical college in Bangalore. I got an opportunity after passing out the common. That time it was a combined medical trace, and I passed out. I got an opportunity in a government medical college, but that time, that government medical college, during my interview panel, I have seen from many medical colleges, including private, people have come, the experts have come to interview, and I thought that in the college where I got, that things were not that high. So that way, my ambition was very strong. I have to have a very solid background of the post graduation study. So I have selected my college for this one as
Right.
Ramaya. I have heard it. Yeah.
Okay, Umra Fatima is asking, is coaching necessary to crack NEET?
Yes, I think because the practice, because I got from my seniors, I got to know the understanding from the seniors that you have to have a huge practice. During the practice session, everything alone cannot be done. I could not have done my competitive exam crack by myself. I agree that. I have taken a special coaching, not in hi-fi coaching. I have seen some coaching center was there, and the who were teaching, I got the information who were teaching them. They were all university professors in the subject concerned, and they have the motivation. The motivation was very strong, and the practice session was very strong. So those things are very important. That's why in the practice it has got some impact.
All right, Surya Mukherjee, Dr. Bhaskar is asking, what are the different types of careers in the medical field? Of course, that was also my question. Like, apart from doctors, pharmacists, nurses, we also have radiologists and so many other related, like you said, physiotherapists. So, other related professions or careers that students can explore. So, if you could just briefly talk about these professions connected to the medical line.
Many of my known, not many from my side, from my class, though during my time, who were my classmates, 3 or 4 have gone after MBBS to PhD and selected subject. Just 1 second, sir. One second.
Yeah, no problems. All right, ladies and gentlemen, that is Dr. Bhaskar that we are chatting with. He is a very renowned doctor, and he has been assisting students not from today. And today we are in conversation with Dr. Bhaskar Bhattacharjee, and he is talking about the medical profession. So the question was different type of careers in the medical field, Dr. Bhaskar.
Yeah. So the thing is that one is this physiotherapy, one is the post graduation. If you tell me after MBBS or before MBBS, if it is before MBBS, yes, there are lots and lots of allied subjects where graduation can be done, post graduation can be done, and at the same time PhDs can be also done. So these are the physiotherapy, and these subjects are lacking. The exposure of these subjects in our country is limited right now, but it is expanding. Demand is there, huge demands are there for a good physiotherapy, for a good laboratory technologist. So for them it is very important. Many people, many of my known persons, they have gone into such type of subjects, and they are in a very good position. Yes, I agree. In pharmacy, even in pharmacy, they have done the post-graduation, and they have done their doctorate also in the relevant subjects, and they are flourishing.
All right. So we've got another question coming in from Tamagana Ghosh. And the question is, can you mention some reference books for preparation for NEET?
With respect to reference books, first is that which examination you want to qualify. If it is NEET, the things are very much clear and crystal clear. It is that you have to carry out the competitive examination books, which are all, any book is a good one, because particularly I do not remember, some JPH guides are there. Jivan Publishing House, they have got some good very good exposure. And the thing is that if you go to any good shop, in bookshop, medical bookshop, or any bookshop, if you ask for a good book, you will see a series of books, and the choice is, because almost all are similar. Some are of, yes, I agree, some are of very not with that high quality, but most of them are. And once you go through that, without seeing the book, don't purchase. You go through the book, you go through the what you want to purchase, have the feeling of getting the affection for that. Yes, one thing I forgot to tell you, you have to love the subject. You have to love the subject of biochemistry, of this physics, chemistry, biology, during the time of competitive examination. The love for the subject has to be there. That impacts a lot. So similarly, you have to love the book what you are going to study, not that by forcing you are studying. It is on the background that you will serve. After finishing the course, you will serve the people. So that motivation will always be there in the background. And for that, whatever you love, which book you love to read, because all are similar. I am telling, all are similar. No specialty books are there.
All right.
Every guidebook is, yeah.
Okay, so Nikansha is asking, what is the advice for someone opting to drop a year and prepare for NEET? Actually, that's one of the questions, Dr. Bhaskar, that does come every time we talk about the medical profession. Shall we drop a year before appearing for NEET?
See, when you start the preparation, I have seen one of my friend's daughter. She is in Narayana school. I'm just giving an example how the preparation starts. In that school, from class 8, that is the segregation. You are going for medical, you are going for engineering. Accordingly, you will have the backup of the study and the practice of studying books and the practice of your normal study. So from class 8, they have stimulated the system. So when you want to start the study, that is important. When you want to start, just 1 second, sir.
No problems. Ladies and gentlemen, we are in conversation with Dr. Bhaskar Bhattacharjee, and he's talking about the medical profession. We're taking questions. And of course, he's talking about dropping a year before going for NEET. Over to you, Dr. Bhaskar.
Yeah. So regarding, I do not agree to that dropping, because your preparation, when you are starting the preparation, that is critical. If you start the preparation 2 months before the competitive examination, then it has got no meaning. You have to have a practice of that from at least from class 11 mid or 11 end, or at least from, I have started from 11 mid, and after 6 months of my class first year, I have started studying on that. I have focused my competitive exam.
So
I have to
some
pass.
students who could not start their preparation from class 8, would you suggest them to drop a year in between and prepare for NEET? Maybe some students could not focus as much as as they should have when they were in class 9th and 10th for medical line. So do you suggest now that after class 12 they drop a year and then prepare for NEET and then apply for it?
But if he has, because I have my some known persons who have done like that, and they have cleared. They have studied very strongly for 1 year, and after that they have cleared.
Of course, now coming over to this question of these centers that help you prepare for the NEET exam. Of course, I'm not asking you to endorse these centers, but would you recommend some online portals now? Because see, what has happened is today, because of COVID-19, Dr. Bhaskar, everything is going online. So today the students have the opportunity to appear in these coaching classes online even from the remotest parts of the country, even from Andaman. Somebody could log into a class that's happening in Mumbai, and that's the beauty of the today's times. So any social platform, not social, but online platform where classes for medical are happening and you would recommend? Of course, I'm not asking you to endorse it, but in your knowledge, is there anything that the students may explore?
Yes, I agree. I agree to your statement that they should explore. They should explore. Yes.
And where do you find these good centers that are giving medical medical coaching? Is it in metropolitans? Would I be comfortable if I say that they are in Chennai, Bangalore, Delhi, Mumbai, Calcutta, or even in the hinterlands like possibly Nagpur, or possibly even in interior cities, B and C cities, there are good coaching centers. What do you have to say on that?
Yes. This B cities like in Pune, even in Kanpur, in Lucknow, centers are there. In Guwahati, centers are there. There's centers are there. But whichever center you focus, you have to stick to that. You cannot have multiple centers at the same time. That makes the path very difficult.
So what is what is the identifying factors for a student to choose whether he should go for center A or center B for coaching?
Number one is who is taking care for the students. Name is not important. Name of the center is not important, but who is giving the study background, who is giving the system who is giving that background has to be there. I have selected that unit based on who will be making our study comfortable, because study has to be comfortable. We have to be comfortable with the who will make us, who will be our teachers.
All right.
Teacher is
Okay,
very,
moving
very
over, we've
important.
got Mr. Surya Mukherjee again asking this question. How can I get admitted to the pharmacy line? Coming back to pharmacy, what a student needs to do to get into pharmacy?
Pharmacy is the examinations are being held on the government level also, and good pharmacy institutes are there. They are run by government and private. Yeah, some private units are also there, and graduation has to be done. First has to be done the B Pharma, then one goes for masters in pharmacology, and very good opportunities there in pharmacy, in pharmacy sector, because lots and lots, you will not believe, in 20 years only one antibiotic has come up. Only in 20 years it was there. In 20 years only one antibiotic has come up. So think the scope. The more serious students are involved in the subject, the more subject improvement will be there, and more. So that's why this subject is very, very important, pharmacy, because medicine sector is run by pharmacy.
All right. All right. Fair enough. And what's your advice to students who are looking into get into, the professions that we were talking about for nursing? Any opportunity? I mean, what's the entry gate for nursing?
For nursing, see, lots and lots of, almost all the state governments, they have initiated a good number of nursing candidates to have their study. And even you will in a state of West Bengal, the cumulative, because of the scarcity of nurses, some higher secondary based and some class 10 based candidates were there. They have been upgraded, they have a bridging course that is helping a lot. So demand is very, very high for nursing. For good nurses are very, very important. Many are going out now. This going out and start getting the job abroad is not easy after this impact of COVID. So India will have a very good number of good nurses. Opportunities will be there, and the study platform is very, very good now.